Welcome to the Physician Wealth Med podcast. It's wealth medicine for doctors. If you're a doctor and you have no time, it looks like you found us just in time. This podcast is for all doctors who would like to work on their personal wealth, but do not have traditional hours to do so because they have no time. We're here to jump into topics that will help you address your wealth both inside and outside of your practice so that you can live the life of significance you're dreaming of. You'll hear from your peers, you'll hear from industry professionals, and your host and wealth advisor, me, Kevin Sullivan. This is your time. Now let's get started with today's podcast. Welcome to Physician Wealth Med's podcast. We like to say it's wealth medicine for doctors. We have a really good podcast for you today, and we have a very special guest, Jeanette Delgado, with JD Management Advisory, Bookkeeping, and Consulting Services with us. So welcome, Jeanette. Thank you so much for joining us today.
Thank you for having me, Kevin. I'm really excited to be here today.
We're just going to have a great conversation here today. But I was going to tee it up with this phrase saying that many physicians prioritize their patient care over administrative tasks. And that might be you, making them unlikely to go through detailed financial management unless they employ a dedicated bookkeeper or an accounting service, and thus the need for this particular episode here today. So I'm very pleased to announce Jeanette Delgado here with me today as our guest. So thank you for joining us yet again. Appreciate it.
Thank you.
My message to physicians who are listening to this episode: if you're a physician who prioritizes patient care over administrative tasks, making you more likely to overlook detailed financial management, then you may need to consider being a patient of your own practice, because that's how important it is. Because you wouldn't overlook any details in your patient's assessment. That would be unheard of. So you need to consider being a patient of your own practice as far as this goes, and not overlook any details regarding your financial well-being. Because after all, it's your practice and you want to maximize its value along the way. And for most doctors, it's your most valuable asset. So Jeanette, thank you for jumping in on this podcast here today. Tell us about yourself and your firm and what led you to work with doctors in this fashion.
Thank you, Kevin, again for having me. My name again is Jeanette Delgado. I'm the owner of JD Management Advisory. I started my firm in 2015 after working for a healthcare consultancy for 17 years, where I was initially hired as the office manager and moved up to be a senior consultant and brought in product lines related to financial products, such as training managers and the bookkeeping task and billing reconciliation processes, and being part of the implementation team after we conducted assessments. And again, mostly working with staff and managers to implement some of the recommendations we had. So that gave me a really interesting perspective as to what goes on with medical practices. Specifically, I noticed, although we worked with startups all the way through academic organizations, I found it very interesting as the models, healthcare models changed, that the independent practitioner was really struggling to remain independent. And so when I went out on my own, I really wanted to focus on that small business, that 1 to 10 provider. And by provider, I mean, it could be NPs or even MAs that might be doing some ancillary services. But it's very important to understand that there's a whole logistical nightmare for these practices, both an administrative side and the billing and the staffing. So all these issues came into play, and because I had the experience of working in these areas, I really felt that I had a lot to contribute. So that's why I went on my own to try to help not just small businesses, but also specifically try to focus on the independent practitioner, the one that really wanted to create a legacy, that wanted to create an autonomy, and really wanted to create the ability to take care of their patients the way they felt they needed to be taken care of. So I really developed and thought through what did I want to do with these practices, and I developed my mission statement based on around that. And my firm really empowers medical practices to enhance their financial health. I'm committed and building my practice around this. I'm committed to drive $80 million worth of revenue growth for my clients over the next 10 years. That's my goal. That's where I'm working towards. And because in the end, their success is my success. Our mission is to provide holistic bookkeeping services that increase revenue, reduce costs, and ensure physician owners achieve year-over-year growth and remain independent. With the vision to be that our bookkeeping services really create this sustainable business cycle and allows them to continue to remain independent, not just in the short term, but the long term. So in the end, the more revenue they generate or can keep for themselves, they can meet all those goals of autonomy, legacy, and really provide the best patient care out there. So as the models change, that might change as well. But right now they're competing against the big dogs and we're struggling with competitive marketing. Everything's virtual now. That in itself is a whole other arena. So that's where I'm at. That's where I feel like I can help.
Yeah, that is super important. I've often thought and actually said that, hey, outside of a proactive CPA that gives you proactive strategies to help reduce taxes and just tax efficiencies and tax management, all of that, a bookkeeper that goes hand in glove, one that understands the medical industry, the one that understands your vision, your goals, your legacy, and your books. It's like a 1-2 punch to have both of them together working for you so you can stay doing what you do, right? I mean, that's the whole point.
Yeah, so there's different areas in the financial industry. You cover one area and have your CPAs. Then you have some accounting and other financial people that fall in between. But a lot of people don't realize that bookkeeping is like the key for all of this, right? So I always say document management is the footers to your foundation. So part of what I do is help with the efficiencies of what documentation am I receiving? How are we maintaining that documentation for various reasons that we could go into later on? But beyond that, then you have your foundation. The foundation is your bookkeeping. If you don't have clear, precise financials that you can submit for whatever area that you're looking at, not just for tax preparation, we're talking about how do we plan for the legacy? How much money do we have to do that with? A lot of times you're looking for a line of credit. I can't tell you how many times I see people get denied for a line of credit because their financials don't make sense. Even though most likely they could meet those obligations of a line of credit, they can't prove that they can handle a line of credit. So that's important. You have to have audits, which are every year. And for all of your information, you have to make sure it's clear, it's easy to come up with, and that you have the reporting that you need to meet these compliance needs. And then you have just your day-to-day management of your business. If you don't know where things land, if it's not set up in a way that makes sense to you for your practice, then it's not going to be of any benefit for anybody. So that's where the bookkeeping comes in. And it's much more complex than most people think. You also have to have somebody who understands the software, whatever accounting system you're using, so that they do prepare your system to create those reports that you're going to need for that area that you have to go into, whether it's compliance or just even creating bonuses for your staff at the end of the year, which we're coming up with, not knowing what it was last year, how did you compute that, what was your logic, all those things you need to be able to document and prepare and understand. And that's where good bookkeeping comes in.
Absolutely. And not to say the peace of mind, I think the best money that I invest in my practice is for these services, because at a moment's notice, you could pull it up, you can see it, you know where you stand. There's nothing worse than not knowing where you stand, especially if you're in the process of trying to get a line of credit or look at some of those options. But that tightness that a bookkeeper can bring can provide such peace of mind. But knowing how to use it, you made a good point there, knowing how to use the software. You can have the best software out there, but if you don't know how to use it, what's the point?
Yeah, and I hear it a lot. It's like, why can't I just do the bookkeeping myself? I have Xero, or I have QuickBooks, or I have this, or I have that. Well, it's like saying, well, an MA can do a surgery. They know medicine. They have the basics. They should be able to do a surgery. No, you have to know your trade. You have to go through different levels of training to get to the point where you can do different levels of practice. So
Right.
as a physician gets more training, obviously they can do more complex uh, uh, services. You're not going to ask an MA to do a neurosurgery. That's ridiculous. So you shouldn't expect that from any other industry.
Right. Or even an office manager that's not trained like you are and that type of thing. Because a lot of times they'll try to bring that in house and keep it in house. And that's okay in some cases. But there could be so many things that are being overlooked or categorizations that need to be categorized properly for this type of thing. Anybody that's listened to this podcast knows we're all about proactivity versus reactivity. There's nothing good that really comes out of being reactive or having to play catch up. But there's all kinds of good things that come out of proactivity. You're doing this on purpose. You're doing it with intentionality. That's the whole point of what we're trying to get through here today, too. So.
Well, and to your point, I see it a lot. So especially with small businesses, you have one person doing multiple things, and that's great. But here's the problem. Because they're doing multiple things, are they capable of doing those multiple things well? So
Right.
if you have a manager, let's say you have a front desk, you have a manager, and maybe you have one or two people in the back helping with the clinical. The manager has to do facility management. They have to do compliance. They have to make sure that the billing is being done properly, however that might be, whether you're outsourcing to third party or doing it in-house. Sometimes you're having your manager be the biller, which case they have to also do customer service because they have to deal with all the incoming phone calls. They have to oversee the front desk, the clinical staff, make sure payroll gets done, all these other things, make sure that they're meeting with the owner and that the owner understands what's going on within the practice that's outside of the clinical. There are so many things that a manager does.
Yeah.
You can pay a very good bookkeeper maybe half of what you would pay for a staff member to do the bookkeeping, doing it correctly. Work with your manager to make them understand what's going on a one-to-one day-to-day, but then meet with those managers and the owner to look over the financials, say, does this make sense? What are the problems that we're dealing with? Do we need to look at things in a more finite way? Are you overpaying for something because the vendor sent you the information incorrectly? There's just so much to look at that you can't afford to have your manager do it all. You need to really focus on their strengths, doing the workflows for the business and making sure that those things are being done, and then outsource those things that are necessary because you can hire more educated people that know what to do, such as a billing company most likely. And then you also have your bookkeepers, you also have your advisors, your CPAs, you have your retirement people. All of these people you are paying for the advice that they can provide to make you a better business owner. And it's really important to understand that not everybody can do it all. That's why you need to make sure that each person is playing to their strengths, including your internal team.
I'm a huge fan of outsourcing. You can go right to the direct, specific expertise professional with all the experience, and you don't have to pay workers' comp. You don't have to put them on payroll. You don't have to do the taxes and all that stuff. So it really ends up being a really nice way to engage in areas that you probably shouldn't be messing around with.
Yeah.
Do what you do best. Let the world see what you do best and the care that you do best, but let someone else kick in. And when you think about the scalability, if you're a small practice and you want to grow, how can you scale if you've got that many hats on? So this allows you to free up your time so you can scale your business as well. I just got off the video meeting with a doctor yesterday that they acquired a practice and they were merging the two back in May. We were involved in helping them go through some of those things. And so this was like a follow-up, how you doing kind of a meeting, And he says, he calls me Kev. He says, well, Kev, he said, the day-to-day grind of just integrating all of these clients it's got so much more workload than I thought. Not only did I pick up the new patients from the new practice, but I'm also picking up new patients from my existing practice. And he said, and I didn't expect that. I thought I was just going to deal with a new set of patients coming in from the other practice. But now there's new coming out of the woodwork. And he goes, at the end of the day, I have to go home. I have 3 kids still, and he says, I'm just feel like I'm burning the candle at both ends to try to find that efficiency. So anytime that you can free yourself up and offload this to outsource it, I think that's a super wise decision.
I just had a meeting with a potential client, a doctor, single practitioner. And one of the things that he told me is he realized that his billing company that he had hired didn't do the work that they were supposed to do. And now his revenue has been affected, and he's not really sure how he's going to set up the new billing company and how to monitor that. And that's where a good bookkeeper that understands medical practices comes in. I'm not a biller, I'm not a coder, but in my past life, I did contracting follow-up and I did credentialing. So I understand some of the logistics of that. And on top of that, I did a lot of the key indicator reporting for various specialties. Mm-hmm. So I understand billing systems, and part of the billing reconciliation process that I did required me to work with different billing systems. So one of the things that I said to this doctor that was important for him was, a lot of times these billing companies will give you reports, but it's reports that make meaning to them based on what they need to bill you. But it doesn't give you the data that you necessarily need. For example, queries can be done in different ways, and the data can be pulled from different data sets in different ways based on data service or data payment or data of ledger, which can be defined in so many different ways, date of deposit. So as a bookkeeper that deals with medical practices, I need to have those conversations with those billing companies so that I understand what those reports, how those reports are being pulled, what is the data that it's really providing, and can it be repeated? I don't want to go in there and say I need to run the March numbers again because I did a slight, I want to see something else and it didn't quite give it to me, and then I run the report and it gives me a totally different number, even though it shouldn't, and that's just because the queries and the data that it's pulls differently, or they may have missed something, and because you are pulling the data by a certain query that you have set up as your regular query, but then the billing company decides, oh, well, we forgot to post this. They post it retroactively, and then it messes up all your numbers. So you want to make sure that when you are working with these companies as a biller, as a bookkeeper, that you understand what reports you're pulling, why you're pulling them, how it's pulling the data, and how does that then translate to your accounting system, because you want to make sure you're capturing that information correctly.
And make it meaningful to the doctor who would like to see where they stand in those areas, right?
It's very important, because if you have physicians that you're paying, associates that you're paying based on productivity, you want to be able to pull that data equally every time, because otherwise that doctor's going to come back to you and say, hey, I ran this report and it says this. I think you made a mistake on my productivity. You owe me more money. So you want to be able to have that intelligent conversation and say, well, maybe yes, maybe no, but why? Why there's discrepancies. And as part of my job is to understand what they're doing, how they're doing it, and what is the data going to give me and how.
So I had sent you a couple of questions beforehand. Is there something that sifts up to the top of most doctors that are kind of like doing this, and man, it would be so good if they did that? I mean, could you touch on some of that? What are some of the things that kind of filter up to the top of concerns?
I think understanding what their needs are financially, and they may not know them. The reality is talking to somebody like myself and saying, okay, this is what I want out of my practice. These are my goals. And what do I need to do to get there? Right? So you need to understand what your goals are initially. What is it that you want to do with your practice? Because it's different. And I'll preface this first. I read somewhere when I was doing some research a few months ago as to see where these independent practices landed. And I think I read something that around 65% of independent practices existed back before COVID, a little bit before then, maybe around 2018. The current data that I was reading within the past year or two, it's dropped down to 47%.
Isn't that something?
The problem is maintaining that independence. So competing. And that really ties into what I do, because a lot of times doctors think, well, I'll just cut back on expenses. I'll just fire some people. I don't need them probably. I just don't need to deal with this vendor. I'll just stick with this vendor. And that way I don't have as many vendors that I need to deal with. But here's the problem with that. If you get rid of staff, then you don't have the in-house support you need. What happens is that creates problems with your patient satisfaction. So you're going to lose patients because they're not going to be happy because you can't give them the proper sort of turnover. Most likely, you're going to have billing issues because you may not have collected things properly up front, wrong insurance card, or didn't collect the deductible, or didn't understand that they had a secondary, a multitude of things, because then you're short on staff. They don't take the time to do all this because they have to deal with more patients. The other thing is they may be able to have a comparison with vendors. So if you are buying the same thing from multiple vendors, you may be able to say, oh, well, this vendor is charging me less. What can you do for me over here? So if you can't do that analysis, because a lot of times you can't go online and just say, how much does it cost to buy X supply or graft or whatever DME you're buying. You don't have that leverage because you don't have those relationships built up anymore. So I understand, but you also want to be able to manage very directly your pricing. So you might not want to get rid of all of your vendors. You may just want to say, well, I'm going to buy this month from this vendor because they can offer me a discount here, or I will split it because this vendor, if I buy a certain amount, they'll give it to me and then I can buy the rest from the other one because I don't get that scale anymore of that discount. So you want to be careful when you're saying you want to cut expenses across the board. You might want to say, oh, I don't want to pay for marketing with this thing here, but I want to go over here, without really analyzing how much of that marketing is really driving your revenue.
Mm-hmm.
You have to really look at the numbers, understand what they're saying to you before you say, well, this is the solution. Or you may get rid of a staff member that turns out was a key staff member. You didn't even know it. The revenue side, they don't realize that if they're using a third-party billing system, that these companies typically go for the easy money and write off everything else. Or they didn't read the contract clearly, or they understood it to be that they're going to handle all of it, and then find out later when their patient AR is growing and growing and growing that they really never were supposed to handle your patient billing. So nobody's been doing it in-house. The billing company hasn't been doing it because that's not part of their contract. And then all of a sudden you have all this revenue. I heard from one physician I talked to, his over 90 on just the patient was $300,000. And this is a small practice. That's a lot of money. That's a lot of money. And the minute that is not collected, the older it gets, the harder it is going to collect. And sometimes you won't be able to collect it. So those are the two sides of the coin that I hear a lot. They don't understand their billing contracts, and they don't understand what it means to cut expenses. So they're not strategic on either side. And if they're both converging, you might as well say you're in big trouble.
Big trouble. Well, that's a good point. Wow. Some very thought-provoking things there, both on the revenue and the cost reduction side. So if a doctor works with you, tell us what that looks like. What does it look like to be a client of your firm?
One of the key things to everything is communication. So when somebody starts working with me, I try to keep that communication going. not just specific, let's meet to look at your numbers, but
Mhm.
I always try to even include them in emails that I am having with people that are related to their practice. So if I'm communicating with a vendor, or I'm asking a question to their manager, or whatever it may be, I try to include them more or less, because you don't want to include them with the minutia. But when there's information that I feel will be important for them to have for the future, or that they can just kind of skim and understand, oh, that she's following up on this, or she's following up on that. The biggest thing for people is not knowing. So
Yeah.
if you have a doctor that has come to you and expressed a problem, or says, can you look into this? And you don't at least communicate that you're either looking into it, or that this is where you stand so far, may not be resolved, but you're still kind of following up. That creates a tension, that creates a stress level that you are there to remove. You should not create more stress for your client than they
Mhm.
already have, because
Yeah.
that's the whole point of the relationship. So there are many times when I hear the doctors say, I haven't even talked to my accountant. What do you know about this? Or did you follow up on this invoice, and did we pay too much for that? Or are we being billed properly by this other? They shouldn't have to ask you those questions. They should be able to say that once, and then you get back with them and you
Yeah.
communicate. And you don't have to do it verbally. That's why we have email, you
Mhm.
know, and
Yeah.
that's all you need, because doctors are busy. Doctors don't have time to sit there and chit chat and do Zoom calls and all. They're busy usually, they're taking call in the morning before they come into the office. They're usually at the hospitals, maybe 3 or 4 in the morning. They come into the office, they see patients most of the day. Then they have to do some virtual meetings with the hospitalists, or with other patients, or
Mhm.
whatever it is. They're not getting home till 8 or 9 o'clock at night. I mean, those are long days.
Yeah.
You can't possibly expect that doctors are going to say, oh, let's have a little chit chat in the middle of the day.
Yeah.
It has to be very planned.
Mhm.
So I always try to at least communicate via email. This is where we're landing. This is where we are. Do you have time? Because we really need to discuss this a little bit further. And in those cases, then you can set up a time to meet, and within their administrative time. And that way you can work around their schedules. So for me, key to anything is the communication.
Yeah.
And that's really the beginning of everything.
Yeah.
And if you can't communicate, you might as well forget it. That's true with any business.
Right.
My role is to remove the stress, provide them information that they can use for whatever it is that they want to answer in terms of their finances.
That is key. And then you add documentation to their day, where they have to document everything, go out with medical records and electronic, all of that goes with it. But I think you nailed it. Communication is key. Seeing them when they can be seen, talking to them when they can be spoken to in various ways of communication, accessibility to you, which is huge. We go out of our way to provide those concierge services for doctors, so that even if it's at 10 o'clock, we don't care. That's when they can be seen. So they will get a response from us even after hours, just as our commitment to them. So it's nice to see that you're thinking along those same lines. Because if you want to work with physicians and doctors, you have to work around their schedule. There's no question.
I just wanted to say that I usually have this rule of thumb, that I tell my clients. If it's not an emergency, email me. If it's something that needs to be addressed, but not immediately, text me. If it's an emergency, call me, because then I know
Sure.
if you're calling me, it's super, super important. And if I'm not in a meeting, if I'm with a client or in the middle of something that can't be interrupted, I will immediately reach out one way or another, say, I will get back to you like as soon as I can. I'm in the middle of something.
Very good. So what's like a final message that you would have the doctors leave with from this podcast? Out of everything that we discussed, is there something that filters to the top that you'd like to say? Hey, remember this?
We're at the end of the year. Tax season is here. Even though you may have just finished your taxes in October, um, it is vitally important that your financial situation is clear by now. If it's not, if you haven't met with your CPAs, if you haven't met with Kevin because you're trying to set up some profit sharing to minimize the amount of taxes and help you set up for the future, you're getting to the point of being too late.
Yeah.
A lot of firms are not going to take you on right now. And you're going to be stuck one more year saying, oh, I really should have made that decision and made it right way before. Because you're going to start getting busy. The holidays are here. People start getting busy with family. And then all of a sudden, they've got to deal with year end and the taxes from 24, and they forget that they have to plan for 25. So my takeaway is decide what you're going to do it now, and don't wait.
Excellent.
Because it's here. And you will know if they want to set up some accounts, you're probably not going to be able to do it at this point, right?
Yeah, it gets to be very, very hard. That's right.
Yeah. So
we laid out a challenge to some of the doctors a few weeks ago to say, hey, look, the 2025 challenge, meet with your CPA as soon as possible because they're going to get really super busy very quickly. But make an appointment with them every 90 days. Find a good proactive CPA bookkeeper like this that you can bunker down with every 90 days and check in. Hey, that should be the minimum, just to check in with them quarterly to make sure that along the way that you're not waiting to the end of the year, but throughout the year, you're getting those well thought out strategies.
I always try to tell them that the last quarter of the year for bookkeepers is the busiest. Why? In terms of my firm, it's because I'm trying to finalize the first 3 quarters, because if they have not met with their CPAs the entire year, meet with them at least by October. Have by September a meeting set up for October so that you can start strategizing, because if you have to buy new equipment and you have to find the money to do that, if you have to create a profit sharing plan or a retirement plan or set up some other structure that's time sensitive, by the time you get into the 3rd quarter, most likely you're behind the 8 ball. So yeah. I agree with you. Every quarter you should meet with your financial planner, with your CPA, have them meet together, have your team talk to each other. That's another big thing. There are many times where I'm reaching out to the insurance guy and saying, hey, are they covered? Because, we bought all this equipment this year, or we have this additional stuff, and I don't know if the insurance is going to cover it. So let's review their insurance plan. Not me review it necessarily, but set up a time with the doctor and say, what does your whole situation look like? Did it change? How much did it change? Are you going to be covered for it? The other takeaway, if you're asking me, very important, is short-term disability. A lot of doctors don't think about that. Is it going to cover the overhead that they have? They'll set up a plan, but then they don't look at it ever again. And a lot of times it's when they were starting and things look differently now, So those are the things that you constantly have to look at and be cognizant of. And if you're not paying attention to your numbers, you're not going to even think about it.
Yeah, good points. So tell us, do you have an offer for the doctors, or what would you have to say to close this out?
Yeah. So before I do any engagement with any of my clients, I have to determine what they look like. Where are they at the moment? And so just like physicians have to do an evaluation of a new patient and take all the diagnostics and get CT scans and images and talk to them about their situation, I have to do the same thing. So what I do is what I call my open book diagnostic. And that just allows me to see where the weaknesses are, where the strengths are, where things can be improved, when can we do these improvements, and then with the owner come up with the solutions that they're comfortable with and what that monthly cost will be to them. That way there's no surprises along the way. The last thing that a business owner wants to hear from somebody like me is say, you know what, this is taking a lot more work than I thought, and I'm going to have to charge you more. Well, no, if we had done that assessment in the beginning like I do, then you wouldn't have to worry about that. So that's what I do. So that being said, I will charge, for anybody who's part of this podcast, a half price on my open book diagnostics. So my open book diagnostics is a $500 fee, so they'll get $250 off. And even if they don't engage me, they'll walk away with a deliverable saying, these are your
Yeah.
weaknesses, this is your strengths, this is, where you can improve. And then we can come up with the solutions and the approach.
I can promise you, doctors, you'll receive way more value from the report or diagnosis that she gives you than you could ever imagine. It's going to be time well spent, money well invested into your practice to be able to do this. Just want to thank you again, Jeanette, for being on this podcast. Thank you for jumping into this conversation. To all you doctors that are listening. And remember, don't overlook these things. These things are way more important than you might think. And I think today we flushed out some of the importance of them that's worthy of taking a look, a second look, a third look to make sure that you can get your financials in order. Have that peace of mind, get it done proactively. And thank you for joining our podcast today.
Thank you for having me. Bye-bye. Have a happy holiday season.
That's our podcast for today. And remember, if you're not working on your personal wealth, who is? Please share this podcast with your friends and colleagues, and make sure you subscribe, like, and share. Any questions about what you heard today, please send an email to kdsullivan@lpl.com. Physician Wealth Meds, wealth medicine for doctors.